ensuring a strong and multi-sectoral response. Let me commend you and the Ministry for your leadership in the response, which has saved many lives. As the United Nations family in Zambia, let me pledge our commitment to supporting the government through the multi-sectoral response plan, and our support is provided through the established response structure across 9 pillars to ensure a coordinated response and the mobilization of resources. Time doesn't allow me today to detail the full extent of UN support so far, but in summary, we have been providing technical support to many parts of the health responsible, including supporting sector coordination, bringing in supplies, including 107,000 COVID-19 tests, repairing oxygen plants at 3 hospitals, and bringing in 358 sets of oxygen concentrators and cylinders, training lab technicians, boosting infection prevention and control measures at isolation facilities and health centers, connecting water and power supplies at Devi Mwanawasa Hospital, and bringing in PPE, including nearly 1.7 million pairs of gloves and 700,000 masks. In addition, Honorable Minister, we play a key supporting role in the area of risk communication and community engagement, and have produced hundreds of thousands of posters, commissioned billboards and radio and television spots, and supported districts' health officers in their own outreach work with community-based volunteers. During these times, maintaining essential health services has been a key priority for the ministry, which we have been glad to support through partnership with generous development partners. An entire year's worth of the 4 traditional vaccines, BCG, UPV, TB, and MR, for routine immunization are being procured and delivered with funding from Sweden, Germany, and UK. An estimated 1 million people in Zambia are expected to benefit from essential health services and commodities supplied by the UN. A total of 2,995 UN interagency emergency health kits are being procured and delivered to MSL for distribution to the all health facilities across the country. And this is funded by Germany, Sweden, and UK. It is so important that basic essential health services continue, and child health in reducing stunting and in preventing new HIV infections. Over the longer term, the UN has been a key partner of the Ministry of Health in health system strengthening, family planning, early childhood development, fighting malnutrition, on adolescent health, birth registration, and many other sectors. And regarding the SDGs, the UN support to the government falls under the framework of the 2030 Agenda, Sustainable Development Goals, in this case, particularly goal number 3 on health and well-being. SDG 3 aspires to ensure health and well-being for all, including a bold commitment to end the epidemics of AIDS, tuberculosis, malaria, and other communicable diseases by 2030. This also aims to achieve universal health coverage and provide access to safe and effective medicine and vaccines for all. Honorable Minister, let me highlight a few areas of importance for your consideration. As Zambia looks to organize the urgent delivery of COVID-19 vaccines, particularly for frontline workers and the most vulnerable, the United Nations system is ready to support technically with procurement and with all the elements that will be crucial to a safe and secure rollout. With all the supplies that have been brought to protect frontline workers provided for COVID-19 patients and keep essential health services running, it is important that supplies are fast-tracked over the last mile so they can reach the intended beneficiaries in a timely manner. In 2019, His Excellency President Edgar Lungu declared maternal and prenatal death a public health emergency in Zambia, and we continue to pledge our support to the ministry's leadership on this critical issue. And last, in the area of adolescent health, we are concerned at reports of rising adolescence and the impact this will have on the health system and national development. Honorable Minister, as I come to the end of my brief remarks, let me just say again that the UN is in all ways a friend of the Republic of Zambia, and we pledge our continued support to the Ministry of Health, both during pandemic and long after, to help improve health and well-being for the people of Zambia. I thank you very much, Honorable Minister.
Thank you very much, Your Excellency, for those very detailed remarks. Allow me now to call upon the Honorable Minister of Health, Dr. Jonas Chanda, MP, to deliver his statement also. Honorable Minister.
Thank you. Your Excellency, the United Nations Country Resident Coordinator for Zambia, Dr. Kumba Gadio, Permanent Secretary, Minister of Health, Technical, Dr. Kenneth Malama, the country representatives from the United Nations agencies in Zambia, directors from the Ministry of Health, ladies and gentlemen, it is always gratifying to meet the United Nations family supporting the health sector in Zambia, and I wish to welcome you once more to the Ministry of Health, though virtually. I wish it was physically. And we count on the UN family as an all-weather friend to Zambia, as Your Excellency rightly pointed out. We are not able to meet physically, but I hope when the COVID-19 pandemic situation improves, we'll be able to meet in person. The government of the Republic of Zambia, led by His Excellency President Edgar Chagwalungu, takes cognizance of the significant role that the United Nations family plays in supporting human development programs in Zambia. In 2015, the UN galvanized countries to agree on a new set of global goals to eradicate extreme poverty and achieve sustainable development goals. I wish to mention that the SDGs resonate well with Zambia's development agenda as articulated in our Vision 2030 and the 7th National Development Plan. I note with appreciation that at country level, the UN family is supporting Zambia to attain these SDGs, which cover a wide range of issues, including areas such as poverty, hunger, health, education, and gender inequality, just to mention a few. Of special relevance to the health sector is SDG 3, which is about ensuring healthy lives and promoting well-being for all at all ages. I wish to put it on record that the United Nations agencies in Zambia have contributed greatly to the achievement of milestones we are currently witnessing in the health sector as the country strives to achieve universal health coverage. I admit that collectively we shall have a lot more to do. Your Excellency, in terms of support to the health sector, Zambia has benefited from the technical, material, and financial support being offered by the United Nations family. The support has been mainly in system strengthening and service delivery. Firstly, the government appreciates the unwavering support towards the fight against COVID-19 pandemic. The United Nations has stood in solidarity with the government and the people of Zambia in responding to the COVID-19 pandemic and ensure resilience in the health system. The UN supported the formulation of the Health COVID-19 Preparedness and Response Plan, communication and community engagement, training of technical staff, strengthening surveillance in communities, procurement of personal protective equipment, promoting water, sanitation and hygiene in health facilities, that is the WASH programs, and strengthening infection prevention measures. I'm also aware that the UN family galvanized efforts to develop emergency appeal for Zambia, which has 3 objectives, namely, 1, supporting public health responses to contain the spread of the COVID-19 pandemic by decreasing morbidity and mortality. 2, providing life-saving humanitarian assistance and protecting livelihoods, prioritizing the most vulnerable and those most at risk. 3. Support to maintain social cohesion through immediate interventions to improve governance, human rights, and gender equality, community engagement and coordination, and mitigating longer-term impact of fragile small to medium-scale businesses. These efforts are well appreciated by the government. The fight against COVID-19 is clearly a mammoth task that cannot be accomplished by government alone, but only with the full involvement of all key stakeholders. We must all work together to address the most urgent life-saving needs to reduce the impact of COVID-19 across health, education, wash, protection, nutrition, food security, law and order and social cohesion, and economic stability. I need to mention that various UN agencies in Zambia have played important roles in ensuring optimal service delivery to the Zambian people. The World Health Organization, through its mandate of striving for universal health coverage, has been working closely with the Ministry in System Strengthening and Service Delivery. In my meeting with the World Health Organization representative, a number of issues were discussed on how we will continue working together to strengthen the health systems for the achievement of universal health coverage. Further, UNICEF continues to support the health sector in strengthening various programs such as immunization, maternal and neonatal health, child health, HIV/AIDS, community health, while the UNFPA continues to support the Ministry in Reproductive Health and Family Planning. The government also recognizes the support from the United Nations Development Programme, UNDP, who have been collaborating with the Ministry in strengthening supply chain management, as well as through the project on reducing unintended persistent organic pollutants and mercury releases from the health sector, also known as medical waste project. I'm happy to state that the ministry has achieved the UN 90-90-90 target. This has been due to the support from UNAIDS and all the UN agencies. Further, the ministry appreciates the support being rendered in formulating the Ramkan roadmap and investment case for the country, and we request for more support so that these documents are finalized. Your Excellency, in our call for support, while acknowledging the enormous support that the UN family has given to Zambia over the years, I wish to bring to your attention some of the areas that still require some investments. Although there has been significant improvements in maternal and child mortality rates, current rates continue to be a public health concern. You may note, Your Excellency, that the country loses as many as 15 mothers every week, and that neonatal mortality is extremely high, contributing to more than 40% to under 5 mortality rates. It is therefore clear that additional investments are required to strengthen the provision of maternal, child, newborn, adolescent health and nutritional services in order to reduce morbidity and mortality. As mentioned earlier, there is need to complete the strategic documents, namely the Ramkan roadmap and the Ramkan investment case for Zambia, in order to aid programming to achieve positive health outcomes. I also need to point out that malaria is still a leading cause of morbidity and mortality in Zambia. The government will therefore continue to lobby for support in strengthening our malaria prevention and treatment interventions to counter the resurgence of malaria in most parts of the country. Your Excellency, let me urge you to continue the support for water and sanitation program in the communities and health centers, which has potential to contribute to the reduction of the burden of waterborne diseases. I'm also very grateful for the support that the UN family has rendered to the country as we prepare for the COVID vaccine acquisition and deployment for Zambia. And I wish to inform you, Your Excellency, that on Monday, most likely we'll be presenting a cabinet memo on the COVID vaccine to get formal cabinet authorization, and the UN family will be greatly engaged in ensuring that Zambia acquires a safe, efficacious and logistically feasible vaccine for Zambia to help in the fight against COVID-19. We acknowledge the support of the UN family in the COVAX mechanism under which Zambia is a candidate. In conclusion, Your Excellency, let me take this opportunity on behalf of the Zambian government to express our gratitude to the UN family for the continued support in strengthening health systems and service delivery. I pledge to continue working with you all as we serve the Zambian people. And I further assure you of transparency, accountability, and integrity in our work. Thank you so much.
Thank you very much, Honorable Minister, Your Excellency, and your delegation. At this juncture, if there are any clarifications or questions to the Honorable Minister, we can have that short session before we wind up with this engagement. Your Excellency, over to you.
Thank you very much. I don't know if colleagues want to take the floor, but we just want to reaffirm on behalf of all UN agencies our support to finalizing the key documents mentioned by the Honorable Minister and prioritizing neonatal and maternal health, WASH, and COVAX support that were mentioned. I think that we are committed and we will be always there to deliver, and we take good note of the areas where we have to strengthen our support. We completely agree with the Honorable Minister's statement that there are areas where we need to strengthen and speed up our support, and we commit to do that. So, Honorable Minister, if you allow, maybe, I don't know if colleagues, you want to take the floor and respond to some of the challenges that were raised. For example, Gift Malunga, I think, on neonatal and sexual reproductive health, you can stay over. Thank you.
Thank you, Elsie. Thank you, Honorable Minister, and let me also add my voice in congratulating you on your appointment. You have raised very important issues for UNFPA, sexual and reproductive health. I know you are no stranger to that. Having served as a member in the Zambia All-Party Parliamentary Group on Population and Development, I think the UNFPA is home to me as well. So for the issues of maternal mortality, we are so much concerned, and we've been working very closely with the Ministry of Health. We noted that from the Zambia Demographic and Health Survey that there's been some notable improvements. But when you still have 15 mothers dying every week, it's a major cause for concern. So we would like to pledge our continued support in improving emergency obstetric and neonatal care, and ensuring that essential drugs and supplies are availed also to the Ministry of Health. We want to work jointly with the UN agencies like WHO and UNICEF. We are working closely, as well as other partners. But what is of major concern to us, I think, is the issue of blood supply, because most mothers appear to be dying due to postpartum hemorrhage and the quality of care. So we pledge our support in working closely with the Ministry of Health in improving maternal health. Thank you.
Your Excellency, are there one or two other interventions before we wind up?
Jonathan, you want to say something on vaccine before we close?
Honorable Ministers, thank you for receiving us and all gathered on this call. I think I want to thank you for the fact that we've worked very closely, the UN family, mostly UNICEF and WHO, working with your technical teams to make sure that we submit all the documentation that will enable us to acquire the COVAX vaccines. Honorable Minister, we're glad to know that we submitted all our documentation on time. And also, as WHO and UNICEF, on behalf of the UN family, we are continuing to engage with your ministry, especially with some of the new information that has come up regarding which vaccines to deploy where, because of some of the studies that came up on the variants and so on. We'll continue to support that. And we will keep you informed on any developments regarding which vaccines, and also when it comes to bringing in some of the vaccines that are needed. We are glad to hear that the CAB memo will be submitted on Monday so that the air is cleared completely about the decision that has been made by the government of Zambia to go ahead with the vaccines. So once again, on the vaccines, that's what I was saying. And thank you so much, Honorable Minister, for your leadership and close engagement with all the agencies. Over to you. Thank you.
Thank you, Honorable, for the opportunity. I see that Tassis is raising her. Quickly, Tassis.
Yes.
So that
Thank you very much, Honorable Minister. Let me add my voice to congratulate you on your appointment, and also for the great achievement when it comes to HIV, Zambia being one of the 7 countries which managed to reach the 90-90-90 UNS target, as you indicate. To sustain those gains, you highlighted that the document we are working on, the Sustainability Framework for Epidemic Control, we are pushing to have that document finalized very quickly so that we can see where we can mobilize additional resources, targeting some non-traditional partners such as private sector and also some efficiency. The other information, Honorable Minister, I would like to share, as you know, every 5 years, the UN General Assembly on HIV/AIDS is organized, and it will be on 8, 9, 10 June. And Zambia has played a very, very important role in 2016 UN General Assembly, which defined the 90-90-90 target. We are calling on your leadership on that moment that Zambia could join at high level and share those impressive experience. Our executive director this weekend will be meeting Ambassador of Zambia in Geneva, the Ambassador of Namibia, and Ambassador of Botswana, as those 3 countries have demonstrated their key achievement, and Namibia will be also co-chairing. So we are counting on you and our resident coordinator to keep Zambia at high-level engagement to share those important experiences. Thank you very much, Honorable.
Your Excellency, any more remarks before we wind up?
I think we can wind up. We took a lot of your time. Thank you so much.
Thank you.
We are grateful.
Thank you, Your Excellency. Before I just call upon the Honorable Minister to wrap it up, just to mention that there was reference to creating resilience to the healthcare system. That is commendable, and on behalf of the Honorable Minister, just to appreciate the efforts. I think the procurement of the health center kits and also medicines for emergency support as we respond to COVID as part of the resilience creation has paid dividends. And I'm sure the appeal we are making through the Honorable Minister to you, Your Excellency, is to ensure that we seriously look at phase 2 of support, because we know this COVID is still with us. And while as government we are looking at how to stabilize the supply chain, we call upon the UN system to see how we can work together moving forward. We take note of the feedback on the blood and blood products. This is a very, very special issue for us, and we are addressing it very, very closely. And already there has been some interventions made in terms of engaging the suppliers of the various consumables, and we hope we can continue stabilizing this situation. So with that, allow me then to call upon the Honorable Minister to give the concluding remarks and wind up the meeting. Honorable Minister.
Thanks so much, Your Excellency, and the UN family for making time. I know you also have your busy schedules there, attending to very, very important duties, but we are grateful, and I'm hopeful that we can engage regularly, especially as we work towards the COVID-19 vaccine acquisition and deployment. But I'm very grateful to get all the reassurances on the support by the UN family, whether towards sexual reproductive health, maternal child health issues, the blood transfusion, blood supply issues, and a lot of other comprehensive support, health system strengthening. I also wish to highlight that, as you may be aware, we are in the process of transitioning Medical Stores Limited is now the Zambia Medicines and Medical Supplies Agency, and signed the commencement order to that effect, I think over 2 weeks ago. And we'll need a lot of support to build systems at medical stores in terms of the procurement system, the storage, the distribution, up to the last mile. So that support will be most welcome. And in terms of the vaccine, COVID vaccine decisions, I think like the WHO country representative alluded to, in terms of the vaccine selection for Zambia, which choice of vaccine we make, we welcome the UN family, the technocrats in the UN family, to work closely with our technocrats, so that we may have a choice of vaccines that are safe, that are efficacious, and that are easier to deploy logistically for Zambia. So that is an invitation that a discussion I'm inviting you to, with our technical team, both formally and informally. We shall welcome that great input. I'm hopeful that as we present the CAP memo to Cabinet on the COVID vaccine, we can make rapid progress, and I'm very grateful for the support of WHO to expedite this whole process, because last time when I met with the WHO country representative, the worry and the concern was on late submission of all the necessary documentation towards the COVAX mechanism. But we are happy that WHO working with our ministry team, have been able to submit all these documents on time for the COVAX mechanism. So with those few words, I'm a politician, I don't want to bore you with long speeches. I just want to thank you this morning for making time, and I look forward to engaging much more closely with all of you. Thank you so much, Your Excellency, and thank you so much to the whole UN team. Thank you.
Thank you, Honorable Minister. Thank you, dear. Thanks a lot for the opportunity.
Thank you very much.
Thank you.